Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. Today's show is about a range of blood disorders that affect thousands of Americans. I'll talk about two major hematologic or bleeding diseases, sickle cell disease and hemophilia. I'll also share my special moment with internationally renowned celebrity photographer Rankin and his portrait gallery dedicated to people living with hemophilia. Let's get started. This coming Sunday, June 19th, is World Sickle Cell Day. I've had the opportunity to care for and learn from many women and men with sickle cell disease. I dedicate this show to them and their loved ones. First off, what is sickle cell disease? It's an inherited blood disorder that changes the shape of red blood cells from round and flexible to sickles or crescent moons, making them rigid or sticky, which ultimately slows or blocks blood flow and oxygen from reaching all parts of the body. Sickle cells die early, causing a constant shortage of red blood cells. Who gets sickle cell disease? Approximately 70,000 to 100,000 people in the US have sickle cell disease. It's more common in certain ethnic and racial groups, including people of African descent, Hispanic Americans from Central and South America, and people of Middle Eastern, Indian, and Mediterranean descent. What are common signs and symptoms of sickle cell disease? Symptoms can begin as early as 4 months of age, so early diagnosis is key. All newborns in the US are tested for SCD. People with SCD can experience severe pain, known as pain crises, anemia, frequent infections, fatigue, swelling of the hands and feet, and delayed growth or puberty. Other serious complications include acute chest syndrome, avascular necrosis, pulmonary hypertension, and stroke. Pain crises are a major health concern and need immediate medical attention, including pain relief with powerful intravenous opioid or non-opioid painkillers. Pain occurs when the sickled blood cells block blood flow to different areas of the body, such as the chest, abdomen, and joints. How is sickle cell disease treated? While there is no cure, several preventive measures can reduce the risk of pain crises, such as drinking plenty of water, avoiding extreme hot or cold, as well as avoiding high altitudes. Infections can be prevented through frequent hand washing, safe food preparation, and vaccines. FDA-approved medications include hydroxyurea, L-glutamine, voxelotor, and crizanlizumab. Acute blood transfusions may be required to treat complications such as anemia, acute stroke, and multi-organ failure. Now, let's shift gears to another blood disorder, hemophilia. This is an inherited blood disorder, bleeding disorder, in which the blood does not clot properly. People with hemophilia have low levels of either factor VIII or factor IX, which can lead to spontaneous or excessive bleeding after an injury or surgery. The two major forms, Hemophilia A and B, occur much more commonly in males than females. About 20,000 people in the US are living with hemophilia, 400,000 people worldwide. I had the honor of interviewing British photographer Rankin, as I mentioned earlier, and viewing his stunning portraits of people living with hemophilia at the launch of his exhibit, Portraits of Progress, in New York City. Signs and symptoms of hemophilia include bleeding in all areas of the body, bleeding in the joints, skin, mouth and gums, urine or stool, as well as frequent episodes of nosebleeds are all examples of how this disease affects patients. Bleeding into the joints can cause swelling and tightness, and the bleeding into the skin can cause buildups called hematomas. So how is hemophilia treated? The best way is to replace the missing blood clotting factor by infusing clotting factors from blood donations or commercially prepared factor concentrates in a lab. Other treatments include medicines to prevent bleeding episodes or physical therapy to manage joint pain. So how can you get involved? This past Tuesday, June 14th, marked World Blood Donor Day. Donating blood is an easy way you can help people with blood disorders. I try to donate a few times a year. Find a blood donor center near you through the Red Cross, the Blood Center, or your local public health department. You can truly save a life. Well, that's all for today. Here's your medical joke of the day. Why does the nurse need a red pen? In case she has to draw blood. Tune in Monday, 3 p.m. Eastern, when I'll talk about harm reduction. Be sure to subscribe to my YouTube channel, write comments below, and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.